basis of eugenics is you have two groups. You have the fit and then you have the unfit. And you're dividing the population into those two groups. So the unfit group is the bad gene pool and you do not want them to reproduce. And the fit group is the good gene pool and you want them to reproduce. So you have positive eugenics and you have negative eugenics. In positive eugenics, you encourage the good gene pool to reproduce. And in negative eugenics, you discourage the bad gene pool from reproducing. So some examples of negative eugenics is forced sterilization, euthanasia, free birth control to the population that's considered unfit, or segregation.
What is an amniocentesis? An amniocentesis refers to a procedure that your doctor does when he or she places a needle through your abdomen into the uterus, into the sac that's around the baby that's filled with a fluid called amniotic sac, and some of that fluid is drawn off for analysis.
CVS stands for chorionic villus sampling, and it's a prenatal diagnostic procedure that is an alternative to genetic amniocentesis. The difference is that instead of placing a needle through the patient's abdomen into the amniotic fluid sac, we are either gently passing a thin, flexible catheter through the cervix under ultrasound guidance to sample a part of the developing placenta. We can also do it by inserting a needle through the patient's abdomen, but instead of puncturing into the sac, we stay outside the sac and we take a sample from the developing placenta.
PGD stands for pre-implantation genetic diagnosis. This is a procedure that's part of in vitro fertilization. The egg retrieval is done, and on about the third day, one single cell is removed from the embryo and can be tested. There are a number of reasons why a couple may choose to do PGD. The most common would be a situation where husband and wife both carry abnormal genes for sickle cell disease or for cystic fibrosis. We can check the embryo and make sure that the embryos that are transferred back are not affected with this condition. PGD can also be used to check to make sure that the embryo has the correct number of chromosomes. PGD is utilized to try and pick the best embryos.
Due to the expense of in vitro fertilization and the reluctance of most clinics to use it for sex selection, alternatives have become commercially available. Some parents turn to a technique called microsort, which is about 90% effective for girl babies and 74% successful for boys. An easier method of gender selection attempts to separate faster-swimming boy sperm from slower girl ones. Called the Erickson method, its creator attests that success rates are as high as 80%.